This is Mrs. Jones. Mrs. Jones has diabetes. One day, Mrs. Jones got sick, so she went to the emergency room. Since she is a Medicaid patient, her visit was paid by taxpayers. She got help, but because follow-up was incomplete, she got sick again and went back to the hospital. Then, Mrs. Jones found a clinic, but they had no record of her earlier hospital visit, so they ran the same tests all over again. Her healthcare system was inefficient and fragmented, and expensive. The Comer Family Foundation launched a nonprofit called Medical Home Network in 2009 to help fix this problem. They created a network of hospitals and doctors in Mrs. Jones' neighborhood so that they could coordinate and better serve patients like her. Now, whenever Mrs. Jones checks in with a hospital, clinic, or even an emergency room in the system, an alert goes out to her primary care doctor through MHN Connect, their innovative new software. Mrs. Jones, like 72% of other Medical Home Network patients, gets a health risk assessment to help her doctor create the most effective and efficient plan for her care. The network also activates Mrs. Jones' care coordinator from her medical home, who reaches out to her. The coordinator makes sure she understands her new medications and makes an appointment for her to see her doctor in a few days. Medical Home Network's care coordinators make almost 20,000 care management contacts each month, and they have helped make sure 85% of Medical Home Network patients don't go back into the hospital within 30 days, 27% better than the county care population overall. Now that she has a plan to better manage her health, Mrs. Jones doesn't need to go back to the hospital, and she gets less sick. When compared to the rest of the Medicaid population, MHN patients are 20% more likely to have timely follow-up care with a primary care physician after a hospital stay or a visit at the ER. By reducing unnecessary hospital visits, Medicaid costs go down. MHN's programs save taxpayers millions. In an HFS pilot, MHN members were not only healthier, they had a 5% lower total cost of care trend than other non-MHN Medicaid members. Now, thanks to Cook County's leadership, Medical Home Network has been able to bring better care to other Medicaid patients. Medical Home Network provides patients the right care at the right place at the right time, saving taxpayers millions and making people healthier. Learn more at www.mhnchicago.org.